Great. So good afternoon, and thank you for joining us. I'm Julie DeSimone. I'm the Program Officer of the Mayor's Wellness Campaign at the New Jersey Healthcare Quality Institute. The Quality Institute is a multi-stakeholder membership organization that convenes healthcare leaders in New Jersey around the common goal of improving the safety, quality, and affordability of healthcare for everyone. A public health crisis such as the one we're facing now with COVID-19 tests our strengths and highlights our weaknesses. At the Quality Institute, we're going to continue to have important conversations about today's toughest healthcare issues remotely through webinars, quality briefings, and other valuable resources such as today's presentation. We'll get through this together by communicating best practices and learning from each other. Just a couple of housekeeping items. Please know that this webinar is being recorded and a copy will be posted to our website later today. All phone lines will be muted for the duration of the program to limit background noise. And you can ask questions at the end of the presentation by typing them into the chat box. The topic for today's presentation is community response to COVID-19 from 2 New Jersey mayors. And by the end of this webinar, we'll learn what municipalities are doing to respond to the needs of their residents, how mayors are staying connected to their residents during social distancing, and how mayors' wellness campaigns are continuing to connect with residents to improve the health and wellness of their communities. We're excited to have Borough of Garwood Mayor Sarah Tedisco and City of Paterson Mayor Andre Saya as our honorable guests for the webinar. Both Mayor Tedisco and Mayor Saya participate in the Quality Institute's statewide community health initiative, the Mayor's Wellness Campaign. The Mayor's Wellness Campaign provides evidence-based tools and strategies for mayors and community leaders to help their residents achieve healthier lifestyles and improve the overall health and wellness in their communities. The Quality Institute has been leading the Mayor's Wellness Campaign in partnership with the New Jersey State League of Municipalities since 2006. COVID-19 is prompting New Jersey communities to face many challenges. With residents practicing social distancing, it's important to develop creative ways to engage with your communities. So we've compiled trusted resources about how to get your community involved to help with those needs and build resilience in your towns. You can access this resource, A Call to Community Action, along with our other COVID-19 resources on our website. Without further ado, I'd like to turn the presentation over to Mayor Tedisco of Garwood, who's going to discuss how she's continuing to stay connected to residents and provide vital information. Mayor Tedisco.
Thanks, Julie. Appreciate that introduction. And I'm honored to be here today with the Honorable Mayor of the City of Paterson. So great combination, I think. Small town mayor, big city mayor. Good to have you on here too.
Honor's mine. Thank you.
Very nice. So, and everyone watching, thank you so much for taking time out of your day to participate in this. So I'm very proud to talk about what we're doing here in Garwood. Just to give everyone an idea, in case you've never heard of Garwood before, we're a very small borough located in the center of Union County here in New Jersey. And we have slightly under 4,500 residents here in the borough. I did look up the data on, let me just check the website, datausa.com before I, as I was preparing for today's webinar. So I know we're all very much looking forward to the census data. So I just want to give a quick plug for that. If you have not done your census yet, please do. It's really important for funding. So again, definitely take care of that census for us. So based on the information I found, just to give you a little idea of Garwood, we have a median household income of $79,000. Our community is very much a mix of blue and white collar workers. We have a median property value of $365,000, and our home ownership here in the borough is at about 62%. So we do have a substantial population of residents who rent here in the community as well. Our demographics are 80% white, 15% Hispanic, and our poverty rate is 4.5% as well. So hopefully that gives you a bit of a picture of our small town with a big heart, as we like to call it. The impact of COVID-19 here in the borough, I am happy to report that over the last several days, our numbers have actually stayed flat. So knock on wood over here. I hope that continues, and hopefully we can continue to flatten this curve and stay safe as possible during this health emergency. So right now the borough is at 41 positive cases. That's a cumulative total. We know some of those people have recovered, which is wonderful, but we don't have exact numbers. Otherwise I would give that. And sadly, it's with a heavy heart that I do share we have had one fatality here in the borough due to COVID-19 complications. That individual was a 75-year-old. Here in our departments, we've felt the effect of COVID-19 in many different ways. For one, our police chief did come down with COVID-19, but he has recovered, he's back to work, and feeling great. We do have another police officer who has tested positive in the past week or so. So hopefully he will have a swift recovery and be back on the force very quickly. And we've taken a lot of precautionary measures here in the borough to protect our departments. Being that they are so small, a low quantity of employees in each department, we want to make sure that we don't have a ripple effect where, for example, our DPW, if it affected one individual, it could potentially put our entire department in quarantine, which would be horrible since we're one of the few towns in our area that still has the DPW picking up residential garbage. So it's really important that we keep that service going and that it's provided in-house. So I'm happy to report everyone at Public Works has been safe. As far as some of the health-focused actions that we're doing here in Garwood, we know that there's so many facets of health, right? It's our physical health, it's our mental health, it's our emotional health, and so on. So we're trying to reach out to our residents to make sure that they stay positive and stay as healthy as possible during this COVID-19 emergency. So we've had an active Mayor's Wellness campaign before this crisis, and now we have it again during the crisis. We haven't slowed up one bit. On Mondays, for example, we do a Fitness Monday. We put a challenge out there. We also share great recipe tips, and I'm going to give a shout out. I think he's watching. Tony Bianchino of Outrun Your Fork, a personal training company here in Garwood, has been instrumental with pushing out wonderful information and helpful resources to our public. And so I want to thank Tony for all that he's doing. In fact, he joined me on my Facebook Live this past Tuesday, which I hold every week to stay engaged with the public as well. I never did Facebook Lives before this crisis, so if one good thing comes out of it, I guess it's that for sure. And then I guess I just want to touch on a little bit more of staying connected to the residents. In addition to the weekly Facebook Lives, I've been posting daily updates with not only our numbers, but I try to put a positive, uplifting, motivational type of statement in there as well. And then I go through the resources that we have, updates in the borough. We are doing fun things wherever possible to just keep our spirits high. For example, our volunteer fire department does birthday rides for the kids who have birthdays in town every Saturday in the afternoon. And it can be a little loud, but honestly, the community really enjoys it. And I thank our volunteers on the fire department and the first aid squad for all they're doing for our community as well. Volunteers really are the heart of our community here in town. Also, I know not everyone is on Facebook, so I try to get letters out to our local papers, and we have expanded the use of Nixle community alerts from our police department to engage residents that, again, may not be on Facebook. And lastly, another good thing that I guess has come out of this crisis, it pushed us to starting email newsletters to our constituents. And so we're really trying to ramp up public information because I think during this crisis, people just want to know, right? We're all in that boat. We want to know. And so to get information out there in a timely manner is so important always, but especially in this crisis. So I'm sure we're going to talk more about the wellness activities. I won't go into depth now, but we're doing a lot here in the small town with a big heart. And again, thanks for having me on, and I look forward to taking some questions.
Great, thanks so much, Mayor. And so we're going to turn it over to Mayor Saya, and then we'll do questions at the end with everyone.
Thank you, Mayor Tedesco. I want to contrast the two of us. You're going to see it's rather stark as far as the city of Paterson is concerned. So if you take Paterson, we're roughly 150,000 residents shoehorned into approximately 8 square miles, which makes us the second most densely populated municipality in the country of any city with 100,000 or more people. New York City is first. They're the most densely populated, and then there's Paterson. So I think you know where I'm going with this. Community spread is a legitimate concern relative to COVID-19. I'll give you an example. I was speaking to a doctor who just opened up a testing site for Pattersonians this week. He said he saw one patient in a family of 12. All 12 members of that household are infected as a result. Because quite frankly, this is hitting communities of color, which is what Paterson is, harder than anywhere else. The community spread, the household spread. So you saw 12 people in that house because they have suboptimal housing conditions. They share a bathroom. They don't have the luxury of a basement to isolate in. So it's almost impossible to avoid your family members because you don't have a sufficient amount of space. So that's why we have the largest infection rate in Passaic County and the third largest in the state. And we are the third largest city in the state. Newark and Jersey City are larger than we are, and they have larger numbers as a result. So what are we doing? We're putting COVID in a box. Last year, we had the foresight to strengthen what we call a communicable disease investigative team, or as we affectionately refer to them as the strike team. So the strike team, we got a grant last year because we were saying there could be a potential outbreak at one of our catering halls, and what do? We have to investigate. And now the term is contact tracing. So that strike team is doing that contact tracing where they identify an individual who's been infected, isolate that person immediately, get a list of close contacts, and then quarantine those close contacts to slow the spread. And we've done that effectively because over the course of the last 5 days, we've seen a decline in our daily infection rate. However, we are scaling up our diagnostic capacity. So as you ramp up the testing, you're going to start seeing your numbers go up, but that's good too, because again, the same model of putting COVID-19 in a box. You identify those individuals who are infected, isolate them immediately, get a list of their close contacts, and quarantine them to slow the spread. So that's essentially what Patterson's strategy has been as far as combating COVID-19 is concerned. I am one of those individuals who's infected, and my wife was infected. And we just found out, we took the antibody test on Monday. Our middle daughter was infected as well, but she has the antibodies, thankfully, to hopefully fight this vicious virus in the future. And I'm going to attribute a lot of what I learned as a participant in the Mayor's Wellness Campaign to the fact that I can stand or sit before you today as someone who can claim victory over the virus. I strengthened my immune system, which is what we were focused on prior to this pandemic. We were talking about eating healthy, becoming more health conscious, steering clear of nutritionally bankrupt food. So I had a whole lineup: vitamin C, vitamin D, zinc, multivitamins. And again, that's something that we've been preaching, practicing, promoting as a part of the Mayor's Wellness Campaign. Strengthening your immune system. So I can't emphasize the importance enough of doing that. It works. It worked for me. I had pneumonia and I had sensory deficit. And I'm fully recovered and I have the antibodies now. So that's something that we should all take into consideration as far as what we need to do to combat COVID-19. And also want to point out, I said it earlier prior to the session going live, we created a program for senior citizens because our older adults are at risk and we want to put them in harm's way. So we've created a program called Neighbor Express where these seniors can call supermarkets, order their groceries, and volunteers will deliver those groceries to those senior citizens. Why do I say that? The participating supermarkets are all a part of our Mayor's Wellness Campaign. Again, it goes back to the Mayor's Wellness Campaign. So I'm glad that we've built an infrastructure as a result of this program. And thank you, Julie, and thanks, Virginia. I'm glad I made your acquaintance at the last convention in Atlantic City, League of Municipalities Conference. And hopefully we'll have one this year and we can talk about what we've done. It'll probably be a little bit different with some physical distancing taking place. But what we've also done with our senior citizens, I should say all residents of Patterson, we created what's called Workout Wednesdays. So we have a staff member from our health department every Wednesday will conduct a session, and she's a personal trainer as well, where people will get aerobic exercise, because that's very important as we proceed in this pandemic. So what we've been trying to emphasize to Pattersonians, while you're home, do your homework, which is try to exercise as often as possible, become health conscious, steer clear of the nutritionally bankrupt food, because there are benefits. Because in the unfortunate instance that you are infected, you have a better chance of fighting off this contagion. So the Mayor's Wellness Campaign has gone a long way for Pattersonians as we continue to stress the importance. Now, in Patterson, and I'm not quite sure if the same could be said in Garwood, I closed all the parks. So that's clearly not something the Mayor's Wellness Campaign would advocate for, but quite frankly, these are the times in which we have to face. And passive recreation is something we probably cannot do in Patterson. There are certain activities that are antithetical to social distancing. And if we open up the parks, we can open up Pandora's box. So that's why we're saying when you're home, you have space, Workout Wednesdays, and then you could just continue to do that on your own with your children who haven't been in school since March 17th in the city. So again, I want to tip my hat off to the mayor's wellness campaign. It works. Stress the principles of eating right, exercising right, and just ultimately living right. Thank you.
Thank you so much, Mayor. And thank you both, for sharing all of what you guys are doing in your towns. It's really helpful, and I'm sure many of our other towns and participants are interested in what you guys are doing. So we are going to get to some questions in the chat box, but I have a couple for you guys first. So anyone who has any questions, you can type those into the chat box now, and Tyler will be taking a look at those. So Mayor Tedisco, you have an established Mayor's Wellness campaign, and you're providing many virtual opportunities that you mentioned for Garwood residents. What are some of your suggestions as the best way to engage residents in the programs while social distancing? So actually getting that participation.
Right. So thanks for that question, Julie. There's two parts of this, right? There's the part where it's pushing the information out there, but then it's also about figuring out, is that information being received? Are those actions being taken? I'm a teacher by day as well. Being mayor is not my only job, although I think they're both full-time, frankly. So it's important that you don't just give assignments, but that you're checking up on them too. So I'll be very transparent. It's one of the challenges that we face, is trying to make sure that that level of engagement is as high as possible. So what we've just devised is a new program we're going to launch on Monday. I'm super excited for, and it's using a bingo board. So it's not the traditional sit down kind of bingo that you play at a bingo hall, but instead it gets people moving. It has all of these different workouts on them. And then if you make a bingo through the workouts and you tag the Mayor's Wellness campaign, which is great because it's spreading the word about all the good things on the Mayor's Wellness campaign Facebook, and then we're going to award some prizes. And what we've done is we're teaming up with local businesses here in town. We know they're struggling too, so it's a win-win. We can engage those local businesses, purchase and get gift cards donated from them, and then give them as prizes as well as some other goodies for folks. So we're at the point we're going to launch it Monday. I'm not sure if we'll have 5 people participating at first, or 10 or 50, but we're going to go for it and promote the heck out of it to try to get the engagement up. But in addition to that, we are also putting out a lot of nutrition tips. Tony did a great cooking video. I know you used it at the Quality Institute as well. So again, we're pushing that information out there, but now the next level comes in. We're trying to check the engagement. And another item I just want to talk about is healthy food is so important as well, right? Making sure that we're getting people food on the table. So some things that we've done here in town, we're one of those communities, as I laid out with the demographics to kind of give people an idea of where we are. We have many people that are fortunate and they have big hearts and they're actually able to donate. So we've been doing this Friday, tomorrow, we're going to have our 3rd food drive here in town to benefit a local food pantry. And then we also have residents in the community that are in need, and there's nothing to be ashamed of, embarrassed of. So we have a local chapter of the Salvation Army that's been instrumental in connecting with those people and giving them what they need, gift cards to the local supermarket, and in particular ShopRite, like the mayor said. Our local grocery stores have been instrumental in Mayor's Wellness too, so it's good to get with ShopRite and be able to have a connection and a win-win really there as well. And in addition, I want to give a shout out to our school system and Governor Phil Murphy for what they've recently put in place. At first, it was just the students with free or reduced lunch that would get meals provided to them. But just this week, our superintendent announced that that program will be available to all children, because we know people are suffering that maybe never suffered before. Loss of employment, we know the unemployment numbers are skyrocketing. So the ability to make sure these kids are getting fed is so important. I recently read an article that said in the United States, 1 in every 5 children is not having lunch right now. That's unacceptable. In our country, totally unacceptable. So I do hope people take advantage of these opportunities, whether it's getting yourself physically fitter, feeling better mentally, or also making sure you get that nutritious food. And I hope that answers the question.
Yeah, you touched on so many important points. I mean, the piece when you're talking about your bingo board, I love that you highlight the connection to local businesses. That's such a important part of the Mayor's Wellness campaign, because we know that even though local businesses are hurting right now, they are huge partners in Mayor's Wellness, and it is a good opportunity for them to participate. So that's great. And to your point, yeah, food insecurity has been a major focus, and we've seen a lot of Mayor's Wellness campaigns shift to think about that a little bit more closely. So we're glad to hear that you guys are doing that as well.
And may I just dovetail on what Sarah said?
Sure.
So mental health is an aspect as well, besides the physical component of it. We've also launched, since students are not in schools, we launched a program called Silk City Storytime. Our nickname is the Silk City because we're the leading manufacturer of silk in the country for a considerable amount of time. So we read to the children. My wife and I kicked off the first Storytime session, and we read a book that we created for the census, and it's called We Count, to encourage numerology and literacy, and also awareness of the census.
That's great.
I love it.
So Mayor Saya, you, as you guys noted, you're coming from very different demographical towns.
Right.
With a population of 150,000 residents, do you have any advice to other large cities and towns for getting that information about your programming out?
Yeah, it is not easy. I just recorded a robocall about the Neighbor Express. We do leverage all types of social media platforms. We send emails out as well. And we do have regular updates with the media. So I have a briefing with a press conference to make sure we get the word out. It's very important. I do have a communications director, which is the benefit of being a larger city. I'm not quite sure if smaller cities have that luxury, but we leverage that here because information is everything. People are misled. People are misinformed.
Mm-hmm.
I hate to take a pot shot, but all the way on the top, as far as the federal government is concerned, you have someone talking about disinfectants and Clorox, and people are probably drinking these things. We don't do that here. We don't have fake news. We follow the facts. That's what we do in Paterson. We follow the facts. And when anyone asks me about reopening the economy, I tell them I can't give you a date, but I'll look at the data. And when we're ready, we start seeing these metrics, like our infection rate going down, our hospitalization rate going down. Then and only then we'll turn the faucet on very carefully. And if we think things are erupting, we'll turn it back off quickly.
Great, thanks. And this question is for both of you. You both touched on it a little bit. There's been so much information out there about how social distancing is affecting individuals, from frontline workers and also to residents, children who are not going to school. Are your mayor's wellness campaigns, addressing some of those mental health issues? Mayor Saya, you mentioned the reading to kids. That's a great resource. Anything else you guys are doing in the mental health sphere?
Ladies first.
I was going to pass it off to you. I get every question first now, but Mayor Saya,
chivalry is not dead, even in the pandemic, during the pandemic.
Very nice. Mayor Saya, I have to say it's such a privilege to be on here with you. I feel like I'm learning so much, and maybe I should read to the students, the children too.
We'll loop you in.
All right, I love it. We actually have a local author here that writes children's books, so I asked him to read his book, and he was able to do it for our library. So then they pushed it out, and they've had another local author read as well. So I love the reading thing, and it's probably the teacher in me too, what can I say? But, the mental health aspect, I think it's really important that there are, in a small town, we have certain resources we can leverage here locally, like volunteers and so forth. But we also need to take advantage of what's already done, like don't reinvent the wheel. And the state of New Jersey has very good mental health resources that I know I've pushed out on my mayor's Facebook page, and it's in the news constantly. And I just really encourage people, if you feel down, call that number, talk to people that are professionally trained in this, because we say it all the time, we're not alone, we're in this together. But yet I understand people feel alone. And so that's very real. So more has to be done. I'm about doing whatever we can to engage the community, because I think as humans, we just, appreciate being around other people. And while we might not be able to be physically together, we can do things that bring us together. So for example, I mentioned the birthday rides before. That's been awesome. Also, we did a Light the Night clap out for our first responders a few weeks ago, and we actually had all of our first responders in a parade, and it was very loud. And even though this town is 0.7 square miles and only just shy of 4,500 people, that parade took a very long time. So I thank the residents for their patience as well. It started at 8 p.m. and didn't end until close to 10, but they went up and down every street, and it really made the first responders feel appreciated, and it also gave the people an outlet to show their gratitude. And I think a lot of people want that. They want outlets to connect with other people, whether it's showing gratitude or whether it's doing things for their community. We have a very active green team, and they just recently solicited volunteers, specifically a Girl Scout troop as well in town, and all the town planters that we have like 25 of them. We had a sign up, and then the kids and their parents went out and planted whatever flowers they wanted in the planters, rather than our DPW doing it. And I love it so much. We might have to do this every year. And, you know, they get to see the fruits of their labor. And on that same path, we are also going to be launching a garden contest. So people that have their garden in their backyard, snap a photo, send it in, and we'll be awarding prizes, possibly gift cards again to local businesses. And so we're doing what we can. There's always more to be done. And I'm a lifelong learner. So I've learned definitely already on this webinar, and I plan to implement even more as we go forward.
Great, thanks. And Mayor Saya, how about mental health focuses? Anything you guys are?
Yeah, it's very important. Okay, so I have to communicate with my community, and we do it with credibility, we do it with consistency, and we do it with clarity. So like I stated before, in addition to leveraging all types of social media platforms, I have regular robocalls almost every day where I subscribe to what's called the Stockdale Principle. Admiral Stockdale was a prisoner of war in Vietnam, and he was communicating with fellow POWs, and he would do two things: give them the brutal truth and a dose of hope. And that's what I try to do every day when I communicate with my community. Give them the brutal truth, what the numbers are looking like. We have over 5,000 individuals as far as the confirmed cases of COVID are concerned, and almost 200 deaths. But I also tell them what we're working on as a part of the mayor's wellness campaign, and talking about how we still have to fill out those census forms, and talking about how we have to exercise regularly, and what we need to do with our children as far as we have a Patterson Music Project, and we're giving free lessons via Zoom, or it is Zoom, not WebEx. It's via Zoom for any child that's interested in an instrument, just to keep people physically engaged, mentally engaged. Because as we know, with this pandemic, you might see a spike with domestic violence. You might see a spike with child abuse. You might see the worst in us come out. So that's why the best of us has to come to the surface and promote these healthy lifestyle choices.
Yeah, great. Thank you. You both have great ideas about reducing social isolation, which we know is directly tied to that mental health piece, and really looking at health in such a holistic way. So thank you for those ideas. At this point, I'm going to turn it over to Tyla, who is going to give us some questions from the audience.
Great, thanks, Julie. So we have gotten a couple of questions already, really good ones. If folks have questions for either Mayor or both, type them into the chat box or the Q&A, whichever you prefer. And I'm going to read a couple of the questions that we've gotten so far. We actually had a couple come in early before the webinar, which is great. First one, what parameters will you use to determine when it is safe to reopen the community? Mayor Say, you mentioned looking at data, so maybe you could elaborate on what kinds of data you're looking at to prepare. And we got another question actually that was very similar. How are you preparing for reopening?
I think that one's for Mayor Saya.
Okay, if you want, all right.
Both.
If you insist, you've yielded the floor, and thank you for deferring. You're very gracious. So like I stated before, there is a clamoring in the community to reopen our economy. Small businesses are suffering. The barbershops, look at my hair. Hair salons, nail salons. And I tell them, I'm not looking at a date, I'm looking at data. I'm not following feelings, I'm not following fake news, I'm following facts. Listen to your scientists. They know what they're talking about. If Dr. Fauci says it, then I feel that's legitimate. If anyone around Dr. Fauci, I don't want to delve too deeply into that, but my point is, I have to look at our infection rates in Patterson. I got to look at our hospitalization rates. I speak to our Office of Emergency Manager every day, and he talks about how calls for the ambulance are on the decline. So that's an encouraging sign. And I also have to look at how many people are getting tested, because quite frankly, if you want to look at best practices, South Korea had diagnostic capacity to the point where they could test almost everyone, and now they're playing baseball. I don't know if now everybody's starting to follow the league, the KBO, the Korean Baseball League, and Singapore did it too. But then you'll see instances where people opened up a little too quickly, and then they saw their infection rate go up. So to me, the metrics you have to monitor: infection rate, hospitalization rate. Let's look at your ICU as well, and then you can make that determination. But you got to slowly open up. Things obviously are not going to go back to normal immediately. So your barber shops, they're gonna have to take extra, and hair salons, extra precautions, masks, gloves, appointment only, distance the barbers or hairstylists from one another. And restaurants, I mean, we're talking about a quarter to half capacity as far as the percentage is concerned. And maybe outdoor dining, that's something to explore as well. And then I'm emphasizing the takeout. But when I issued my executive order March 16th, closing down non-essential businesses, it hurt because I know a lot of these mom and pop shops are suffering. And that's why we had a small business seminar with Senator Menendez to ensure them that there is relief. I mean, there's hope on the horizon as far as federal programs are concerned with the grant funding and other levels of financial assistance. So the metrics are important to us.
Right. I would have to agree with everything Mayor Say has said there, but I just want to add too that it's been pretty clear to me, and maybe it's different coming from a small town than a big city, but the governor really is in the leadership. He's in the driving seat of this. So we really, from what I'm being told, we really have to see what he has to say. And he's talked about the same thing, data before dates. And we just have to trust in our scientists, trust in our professionals here, because they know a lot better than I do, right? Or any one individual. They're a team, they're working at this, they're looking at it every day. I'm in a small borough. I don't have a hospital per se. But while those decisions are ultimately the governor's, we do have certain local decisions that we have to make too, like as far as our parks go. I have 2 parks in town. One is a playground and a basketball court, essentially, that has remained closed. The other more open air facility, the recreation complex, I decided, along with consulting with my police chief and my OEM director, that we are keeping the park itself open because it has a nice walking path, but we also are keeping the baseball field, the turf field, and the basketball court closed at this time. We're also fortunate we do have a security camera monitoring system there, so if kids hop the fence of the turf field, or if we see too many people gathering, the police are right there and breaking that up. So we're able to do that. And as long as people can keep up the passive recreation responsibly, I'm all for continuing to do that. So I was, for one, very happy to see Governor Murphy open up the state and county parks for passive recreation at least. And I have to say that, this situation evolves daily. We get new information, new decisions are being made. We see how many executive orders the governor has issued. In the beginning, I was very bold with some of the action I took. I don't necessarily look to get on Channel 12 News, but I happened to because one of my greatest concerns was grocery stores. So I actually reduced them to 50% occupancy about a month before the governor did that. But I quickly learned that the governor and the attorney general preferred if I followed along with what they were doing. And now they've been very clear about that. I think from the first week or two that everything was really, it felt like, the floodgates were rushing in. And now I think we're at a point where everything is communicated very effectively, consistently. And so it's important that as a local government, I think that we stay focused on our issues and defer to the state government where we have to on the bigger issues, where they're the ones with the firsthand data.
Well said. And Sarah, you made me feel badly. I'm going to be on News 12 today.
That's okay.
Around New Jersey, around the clock.
Maybe I'll check that out.
Great. Thank you both. A couple other questions, and folks, you can keep getting those questions and we'll answer as many as we can. Something you touched on about reading to kids and participating in educational activities. Are there other types of educational activities that towns can do to make sure that kids are, in addition to doing their schoolwork online, staying busy, staying active, and doing things that are more educationally focused?
I want to focus on the census since it is timely, and response rates are probably not where they should be. But New Jersey, to our credit, is almost at a 60% clip as far as response rate is concerned. Patterson's at 41%. So we have our work cut out for us. So any activity that you can incorporate census awareness, I would encourage that, because while you're home, I say to my residents, do your homework. And that's part of doing your homework. And it can touch on so many different aspects of education, whether it's the math, because tell them why you need to count, and then also it's geography. And it's also about resources, right? Because there's money available for school facilities. There's money available for road resurfacing, There's money available for potentially another hospital if that's what you need in your community. And then it's also a matter of political representation. So I feel like there's a dual purpose to it. It's a call to action, and it's something that can be probably one of the most valuable lessons you can learn, because it takes another 10 years before anyone starts talking about it again. And I tell my residents, it takes about 10 minutes to take the survey, and it'll take another 10 years before you could do it again. So why wait a decade and waste a decade?
Right. 1 minute a year. There you go.
Precisely.
That might
Look,
be a
wait,
nice
wait.
line.
By the way, there it is. Patterson counts. I wear my
Very
heart
good.
on my sleeve and the wristband here.
Very good. I like that. If I'm still mayor in 10 years, I might have to invest in some wristbands. So what we're doing here in Garwood, I talked about a couple things. I love the planters. That was great to get the kids out there with their parents and seeing the fruits of their labor, and what we're doing on the gardening front. Reading to the kids, and our library, give a shout out to them. Their Facebook page, they've come up with very interesting challenges for kids to do. Like they had one, a book face challenge. You have a book with, say somebody's like holding an apple like this, and so you would put your hand where the hand on the book would go, and it was pretty cool little thing. So you can check out those challenges that we have out there. I put one out personally, asking children to create Garwood Strong posters, put them in their window, take a photo, turn it into our volunteer celebrations committee, and I'm personally donating gift cards for those children that win. So we should be announcing winners very soon. And I feel like I have so much to say on this topic as a teacher, but I know our teachers in the Garwood Public Schools are doing a phenomenal job. Our gym teacher, or I should say physical education teacher, right? He's been doing YouTube videos where he does gym class in jean shorts. So it's a pretty big hit. He might be such a big YouTube sensation soon. We don't know. We'll have to keep an eye out for Mr. Burke, but I know he's very popular.
As long as he doesn't do it in Daisy Dukes.
That's great. Thank you both. So another question, and this one's going to be certainly a challenge for everybody, but once more things start reopening in addition to the parks, do you have any plans or any thoughts about making sure that people continue to social distance and continue to wear masks, even when things are reopened? I think that's going to be a really important step that we all take.
Sure, I'll go for it. And I think this is a good tie-in with Mayor's Wellness because of that local business connection. And we have an active Chamber of Commerce here that's regional, but again, active. And I personally, my initiative this year was to shop Garwood, pushing shop local. So I ended up having a breakfast with a number of business owners before all of this went into effect. So I feel for a small community, we do have a personal connection with many of our businesses here. And I think it's utilizing that connection to make sure that they're following the rules. Honestly, I received a resident complaint from going to one of the establishments in town. I just picked up the phone and called the business owner, and I said, hey, look, this is uncomfortable for me to share, but I received this call. It's from a loyal customer of yours, and I think you want to know about it. And they were able to correct the wrong right away. And I think that's important to talk to them about their strategies. But definitely what Mayor Saya was talking about with our salons, spacing out the chairs, using disposable, maybe like gowns for the hair salons, for example, instead of that vinyl or whatever it's made out of. One they usually put on you, it might have to be a disposable, so it could be thrown away after. We got to be careful, though. We don't want to ruin our planet too much in the interim. I know I'm a big fan of our green team here and all we're doing with Sustainable Jersey, but it is what it is, safety first. So we'll be looking at everything and talking with our business owners and being there to help them in any way we can. So I hope that answers the question. I hope it helps.
Yeah, and we emphasize enforcement in Patterson. I'll give you an example. Within the police department, we created what's called a COVID-19 compliance unit. So we have active patrols looking for people who are not abiding by the social distancing guidelines. And to date, I can tell you that the police has issued about 700 tickets for people who are not complying and about 1,000 warnings. So you can see what we're up against here. And it's all about asking people to reacclimate to the new normal. So those compliance units, COVID-19 compliance units, are going to be around for a while until obviously we're able to identify a effective treatment and then the vaccine.
Great. And one last question that came in. So if folks have others, I know we have Mayor Saya for another couple minutes. So if you have other questions, ask now. But this last one.
And listen, I'm thoroughly enjoying this experience. I appreciate the opportunity, but I have to hop on with Michael Bloomberg because I get briefed on the best practices. Because like Sarah said, this is a rapidly evolving situation, and real-time decisions have to be made based on what you're confronted with.
Absolutely. So this last question I think is a good one. How has this pandemic changed your relationship with the healthcare providers in your community? Have you been working more closely with them? How have you been interacting with healthcare workers?
Do you want to go first or me?
No, please, ladies first.
Okay.
Come on, Mayor.
You got it. I have to say, I didn't think I would ever speak with my health officer so many times, but she's been a wonderful resource, and it's a regional health department that we have. So she actually has something like 8 towns, and Garwood's one of the smaller communities in that regional health department, but she gives service as though I'm the only town. So I really do appreciate everything they're doing there. And I joked actually that before all we would talk about is what could we do about rodent problems in the town. But obviously that's a problem that, it's one of those issues. There's like 20 cases every year. And we do what we can as a municipality, but there's homeowner responsibility. Anyway, not to go on a tangent about that, but I've been in frequent talks with the health department every step of the way through this process. So it has changed that dynamic. And I think it makes the state have to think about something, or maybe the towns. It's different for Garwood being small. I think it's a very important key shared service we have. But you have a department with 8 towns, and then this happens, it's tough. It's very, very taxing on that department. And I know that I spoke with the state senator, Tom Kane, who said that there were talks in the state about shifting resources from some health departments that maybe had a few people that could go to another health department. I don't know if that ever really worked out because this is such a massive problem that's everywhere. But it makes you rethink sometimes what you're doing regional strategy wise, that maybe may have to be rethought. So we'll have to see how that progresses. But I have to say, as far as the professionals on that end, they've been nothing but top notch.
And I speak to my public health officer at least 4 times a day because I get updates as to what the infection rate is like in the city. And then I visit the contact tracing team that's doing a lot of that meticulous work because it's a painstaking process. I visit them to provide them with a little bit more motivation because a lot of them are working very long hours. And I want to reassure them that I appreciate what they're doing. And in the grand scheme of things, they're helping us combat COVID, that we're slowing the spread because of the actual work that they're doing. So I talked to him, like I stated before, no less than 4 times a day to get regular updates. And I'm looking now to expand capacity. We want to build bandwidth within the contact tracing team. So I was just on a session with Rutgers University. They want to help us increase capacity. And now we're reaching out to the Citizens Campaign. They want to help us get more contact tracers. And part of what we also want to do, we've been distributing meals to 1,400 senior citizens. We want to expand that program. And we've been distributing masks to the senior citizens, but now we want to elevate our efforts and make sure that every Pattersonian, that's our demonym. If you didn't know that, that's our demonym. I don't know, you're Garwooders?
We're Garwoodians.
Garwoodians, I love it. So Pattersonians, not Garwoodians, would be getting masks. We want to make sure that people get that PPE.
Very good. I just want to give a quick plug too. If anybody,
Garwoodians.
You like that, right?
I do.
Pattersonians. I know a new word today.
That's our demonym.
Very good. I have had residents reach out sometimes about masks, and I've personally delivered them. So whatever it takes, we're willing to do.
You're my favorite Garwoodian.
Thank you. Am I the only one you know? Probably.
By default, yes, you are my favorite Garwoodian.
Anytime you want to come to Garwood after this health emergency is lifted, dinner's on me.
Yes, thank you. I like Middle Eastern food.
Okay.
Thank you both so much. I don't have any other questions at this time, but we'll give folks just a minute while we wrap up if there are any last minute questions that folks have. While I share with everybody Just a quick plug for our next webinar in the series. We are going to have Brian Oliveira, who I believe is on today actually, the Executive Director of the Garden State Pharmacy Owners. And he's going to be talking to everybody about what it means to be a pharmacy owner and a pharmacist in the community, and how folks can interact with their pharmacist in the safest way possible, make sure that they're still accessing their medications, and making sure that pharmacists are able to work with everybody within their community, from local leaders to providers, to make sure that folks are staying safe but still getting the care that they need. So that webinar is next Thursday, May 14th, and I think it'll be a really great presentation. The link is up on your screen for where to register, and you can find all of our other upcoming webinars in the series at that link as well as on our website. You can find our QI COVID-19 resources. That's where we have all of the resources that we've put together to date. We've had several webinars in the series that you can look at the recordings as well as download the slides. We also have several resources put together in addition to the Mayor's Wellness Campaign resource that Julie mentioned earlier. We have a resource on telemedicine, how to make sure that you're aware of your benefits and where you can access telemedicine, which is very important. We also have a resource on advanced care planning, so that you know how to start having those conversations at home with your family, which is of course extremely important right now. And we are also coming out probably next week in a conjunction with the pharmacy webinar with a prescription assistance guide. Most of our pharmaceutical companies have patient assistance programs to help financially with your medications, as well as delivery programs. A lot of pharmacies are delivering at this point. So everybody keep a lookout for that, and please make sure to visit our website to see all of our additional resources as well as upcoming webinar programs. So with that, I don't see any other questions. So we'll hop off a few minutes early, but wanted to thank Julie from the Mayor's Wellness Campaign, as well as Mayor Tedisco and Mayor Saya. Thank you so much. I think this is really, really helpful for everybody. And we'll make sure to follow up with this presentation for all of our attendees. We'll send you the recording as well as some other resources that were mentioned today. So thanks so much for your time, and hope everybody has a great day and stay safe.
Thank you, everyone.
Yes.
Thank you. Stay safe.
You
Thank
too.
you.
Stay healthy.
Got it.
Well.